Hi there, this is Angela Aberg. I'm a chiropractor in Escondido, California, and I decided to make a video today to help moms decide when to bring their children into a chiropractor. It's a difficult decision, I understand. I'm a mother myself. But there are a few reasons to bring your child in for care. First of all, if there was an induction or epidural done, an induction often makes labor really intense and then requires an epidural. And if an epidural is done, that means mom can't be up and around walking. And up and around standing, walking on hands and knees, these are all good positions for baby to travel through the birth canal and be delivered easily. So induction and epidural both mean a little more force may have to be put on the baby's head and neck in order to deliver. So these are a couple of reasons to bring your child in for check. Also, if your baby had a face or a brow or what's called a chin presentation, normally the baby is delivered and you see the top of the head first. If the head is extended back, then the first thing that is seen as the baby is delivered is either the brow or the face or sometimes even the chin. So that requires a lot of head and neck extension, as you can see. If baby is delivered in that position with a face or a brow or a chin presentation, it means a lot of extension for the head, and it can be injury to these upper areas here. Even some of the nerves that are coming directly out of the skull called cranial nerves. One of those cranial nerves, number 9, is called glossopharyngeal nerve. That nerve goes to what is called the pharynx, this area here that's responsible for speech, tongue movement, diction, ability to say words and say them, pronounce them clearly. So if your baby had a face or a brow or a chin presentation, there may be injury to your baby's upper neck which in the future may cause your baby to have language delay or speech delay. Other things we see with infants is a lot of spitting up. If your baby has just a little bit of spitting up, that's kind of normal. If your baby has a lot of spitting up, a lot of projectile vomiting, then that may be an indicator that something isn't right with baby's digestion, and spinal adjustments may be indicated. Also, crying. Colic is indicated if the baby is crying for 3 hours a day, 3 times a week, 3 weeks or more. That's an awful lot of crying, and a lot of times moms are tired, they're exhausted with this kind of crying, and chiropractic care can really help these children. Also, if a baby's head doesn't want to turn one way or another, you might notice your baby doesn't want to turn one way or the other. Sometimes the babies will or will not turn, and if that's happening, then they may not nurse on one side or the other either. So if you notice that your baby is resistant to turning his or her head one way or the other, or if the baby won't nurse on one side or the other, that's indicating a stiff neck or something happening inside the neck muscles or bones or tendons or ligaments, and that is a good reason to bring your child in for care. One thing you might notice, if baby doesn't turn their head equally, sometimes they even end up from laying in the crib with a little flat spot on one side of their head. And sometimes you'll see these babies with helmets on. Well, the helmet helps the head regain its normal size and shape, but it doesn't help the neck motions to regain their joints, to regain their mobility. And so there is a good indicator for your child to be checked for chiropractic care. If your baby isn't pooping regular, babies should poop every day. If your baby isn't pooping every day, then possibly the nerves going to their digestive tract aren't working exactly right, and it's a good indicator to bring your child in for a chiropractic checkup. As children get older, then sometimes we'll see multiple ear infections. If the muscles and the ligaments up here are tight and tense, and those little spinal bones are subluxated, as we call it, and now it's been a long time those spinal bones have been subluxated, then that can cause multiple ear infections, sometimes even round and round of antibiotics, one after the other. Still doesn't help. That could be an indicator that your child has some tension in these upper neck vertebrae, and that a chiropractic adjustment could help them. Asymmetrical crawling. Usually kids should crawl hands and knees, both one side and then the other. If they're not doing that, they may crawl on both hands and the side of one leg, or they're kind of in a half sitting position when they crawl. These are all indicators that something in the low back is going on in their sacrum, and so little adjustment to their sacrum can help them get up on both knees and crawling symmetrically, just the way you see a usual baby crawl. So just to review, a couple indicators that you might want to bring your child in for a chiropractic checkup: epidural or injection or induction of delivery. If your baby has a face or a brow or a chin presentation, if vacuum or a forceps were used during delivery, definitely want to have your baby checked. Or if you have spitting up, crying, won't nurse on one side, doesn't want to turn their head to one side, if your baby isn't pooping daily, also if your baby has had multiple ear infections or doesn't crawl symmetrically. We're happy to help at Escondido Hills Chiropractic. Our motto is healthy kids, healthy community.